If you like your healthcare plan, you can keep.
Obamacare, or the Affordable Care Act, demands that all health insurance plans conform. Healthcare is changing for everyone. Some are concerned that it forces the payment for abortion and abortion-causing drugs, that it is an unjust tax, or that it places states' rights over individual liberty. Those are all valid concerns. However, there is something even more alarming that few are talking about. Something about Obamacare that should trouble us all deeply. Population medicine. The purpose of medicine has always been to heal and maintain the health of the individual. A sick patient yields to a doctor believing that the doctor will use his knowledge and skill for the patient's good. The doctor must take responsibility to protect the patient, because to do otherwise would violate the sacred trust between the healer and the healed. To this day, you, the patient, make the decisions about your health care. You, the patient, define what good health means. With the growth of technology and rising costs, health insurance was introduced, but the patient always remained first. With Obamacare, the government has replaced the individual as the primary healthcare decision maker. Government decides what good health is and what services will be funded, not you. Sound crazy? Here's an example. Mary is a 75-year-old woman, 2 kids, 5 young grandchildren. Mary has cancer of the ovary. Today, her doctor recommends surgery costing $10,000. She is cured and after recovery lives happily for another 20 years. Fast forward to 2014. Obamacare is in full force. It has been determined that the average healthy 75-year-old woman is expected to live to 78. Mary is diagnosed with cancer of the ovary. Her doctor knows that surgery will be more expensive than allowed. Over budget means a financial penalty and a poor public review. Sorry, Mary, there's nothing we can do. Obamacare is not health care precisely because it replaces the individual's health needs with government health care objectives. It places a dollar value on your life and denies care if the cost exceeds your value. In the name of health care for all, it destroys health care for each one of us. But what can I do? After all, I am just one person. That's exactly the point. You have 4 options. You may choose an inhumane government-approved plan based on population medicine. You may become a conscientious objector by not purchasing health insurance at all and paying financial penalties to the IRS. You could engage in civil disobedience, opting out and refusing to pay the fine. Or you could join a Christian cost-sharing community such as Medishare or Samaritan Ministries and avoid any penalties. For now, at least. By participating in population medicine, doctors and patients alike give our unspoken approval to the dehumanization of friends, neighbors, family, and others. How will I be able to provide for my family's health care without health insurance? Jesus says, "Seek first His kingdom and His righteousness, and all these things will be added to you." Many times He chooses to provide for us through other believers, encouraging the faithful to bear one another's burdens and thereby fulfill the law of Christ. If our God can create the world out of nothing with just His words and hold together each molecule that makes our physical bodies, the security of health insurance is an illusion. Now is the time to testify for the dignity of each human. Reject the inhumanity of population medicine. Do not participate in Obamacare.